Good afternoon and good morning to you if you're on the West Coast. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health in Public Housing. Thank you so much for participating on the last call, part of the Learning Collaborative, the role of CHWs on teen pregnancy prevention and HPV vaccine promotion in Hispanic adolescents girls living in public housing. With me is Research Assistant Fide Sandoval. She has been with the National Center for 1 year and a half, and she's been providing training and technical assistance to community health centers and doing research for the National Center. And before we get started, first and foremost, I want to thank all health centers participating on this call for all what you are doing to address the COVID-19 pandemic. Thank you so much for your work. Thank you so much for everything that you're doing to address this public health emergency, probably the most important emergency of the last 50 years, and if it's not the most important, one of the most critical emergencies that we have had in the last 50 years. So thank you so much for everything you're doing. And if you would like to share some best practices or some challenges with us, you can send us an email. My email address is jose.leon@namgt.com. Again, my email address is jose.leon, L-E-O-N, @namgt.com. And if you have any topic or any news on COVID-19 challenges or best practices that you would like to share, please contact me at any time. Also, tomorrow, public housing primary care grantees are having a conference call on COVID-19. If you are a health center in or immediately accessible to public housing, please also send me an email so I can send you, I can share the link for this conference call. We are going to have health centers from different states participating on the call and sharing with us best practices, challenges, outreach programs, and all that they are doing to address the COVID-19 pandemic. So again, thank you so much for everything you're doing for helping the most vulnerable and the low-income populations and the special population. Thank you so much. So next slide, please. So we are the National Center for Health in Public Housing. We provide training and technical assistance to community health centers in or immediately accessible housing. The role of the National Center for Health in Public Housing is to provide training and technical assistance to all health centers on different topic areas. So we have different activities on increasing access to care, on promoting health equity, on improving health outcomes. So if you are interested in any of these activities, you can contact us, or you can go to our website and www.nchph.org, and you will find additional information on all the activities that we're doing. Next slide, please. So this is a live activity. This moment our lines are muted. If you have any questions, please save your questions to the end. You can either use the chat box, you can in the chat box, or you can use the raise hand icon and your lines will be unmuted. So remember, we have a Q&A after the presentation. Next slide, please. So through this learning collaborative, we have discussed issues affecting public housing residents, specifically the issues affecting teens in public housing. Fide is going to expand and discuss additional, it will give additional information on the issues affecting adolescents in public housing. We have shared information on the social determinants of health affecting public housing. We have heard from some of the health centers. On our first call, we had the opportunity to hear from La Maestra Community Health Center in San Diego, California, and they share information on the at-risk youth program that they have and how they use and train and collaborate with CHWs to address the needs of these at-risk population in San Diego County, California. Then we briefly discussed some evidence-based programs and some aspects or models, I guess, that you can use to provide training to either adolescents or parents. And then we heard from another health center, Altamed, in Los Angeles, California, and they shared the teen pregnancy prevention program that they have in place. So they've been providing teen pregnancy prevention for the last 20-25 years, and they've been working with both the federal government and the local government. So that was very helpful for those health centers trying to address this public health issue in their communities. And today we have, for learning objectives, we are going to first list all the health issues impacting adolescents living in public housing. We are going to review some approaches to teen pregnancy prevention. We are going to list some interventions using community health workers, and we are going to revise evidence-based intervention with community health workers. Next slide. So I'm going to stop for a moment, and I'm going to turn it over to Fide. Good afternoon, Fide.
Hi, Dr. Leon. Thank you so much for letting me present on this. Like Dr. Leon said, I'm the research assistant here at NCHPH, and I am also a certified health education specialist. So I am very pleased to be able to share with you some of this very important information affecting public housing residents, as well as some evidence-based practices. So first, we're going to start talking about the health issues that are impacting teens in public housing. So teens living in public housing have a higher risk for involving in risky behaviors due to their housing instability and lack of social support exposure, and their exposure to violent situations. And also some of these risky behaviors can also be attributed to their socioeconomic status. Teens' behaviors have a huge impact on their current and future health. So some of the preventable behaviors that it is important to take into consideration here is behaviors that have to do with substance abuse, violence, unprotected sexual intercourse, and also other risky behaviors to take into consideration is regular tobacco use, binge drinking, marijuana use, use of illicit drugs, other than marijuana, physical fighting, suicidal attempts, and thoughts, and more. So here we have basically an overview of the sexual behaviors that exist among teens. So in 2016, youth aged between the ages of 13 to 24 accounted for an estimated 21% of all new HIV diagnoses. And about 210,000 babies were born to teen girls aged 15 to 19 years old. So in these graphs, we can see basically percentage of high school students who were currently sexually active. And this is based on 2017 data from the YRBS. This is basically from the CDC. And also we have some information in regards to the percentage of high school students who ever had sex, had 4 or more lifetime sexual partners, were currently sexually active, they use a condom, and so on. So for those who are currently sexually active, we can see that those who are Black African Americans and Hispanics have the highest rate. For the percentage of high school students, I'm so sorry about that, that have ever had sex, based on 2017 data, the trends, you can see all the way to the right column that, we have some green colors, some red colors, and yellow. So basically the green shows that the improvements are going in the right direction. If you see something that has the color with red, that means that the improvements are going in the wrong direction. And then the yellow means that there still needs to be some improvement to be made, or that there hasn't been a significant change. So for those that have ever had sex, the improvement, there has been improvement. That have had 4 or more lifetime sexual partners, there has been an improvement. That are currently sexually active, there has been an improvement. And for those that, unfortunately, for those that use a condom during their last sexual intercourse, there hasn't been an improvement. And actually, there has been a decrease on that. And then for the use of condom and effective hormonal birth control, it has been kind of steady, the trend. So there hasn't been an improvement, and there hasn't been, basically hasn't been going backwards either. So here we have some information about the birth control used among teens. So Hispanic teens, as seen on the first graph, they have had the lowest percentage of effective hormonal birth control use. And then on the right side, Hispanic teens also had the lowest percentage for use of dual methods of protection. This includes hormonal birth control and condom use. So this also kind of basically gives us a confirmation about the importance of targeting the Hispanic population in regards to providing birth control, use, education, and so on. So substance abuse and violence. So this is also another very interesting and also important topic to be able to discuss. Unfortunately, violence and substance abuse, these are some very risky behaviors, that also contribute to teen pregnancy. So here we can see that the trends for those students that did not go to school because of safety concerns, that were electronically bullied, or that were bullied at school, or were forced to even have sex, the trend hasn't really changed. There hasn't been an improvement either. But then the trends there has been an improvement on the trends for those that have been threatened or injured with a weapon in school, and also for those that have been having physical dating violence, or that have experienced sexual dating violence. In regards to substance use and violence, the percentage of high school students that have ever used illicit drugs, illegal drugs, the trend has been going down. All right, so I'm going to pass it to Dr. Leon. He's going to talk to us about the approaches to teen pregnancy and prevention.
All right, thank you, Ire. Thank you for providing some highlights regarding the social determinants of health and health issues affecting residents in public housing, and specifically teens living in public housing. All right, in regards to teen pregnancy prevention and approaches, remember that there are several ways that you can interact with the members of your community. The very first one is just to discuss the issue with your target population. There are several programs, evidence-based programs, addressing how you can get involved in conversation with adolescents in the community. Remember that at first you need to have an assessment. You need to go see whether there is a need to provide this prevention program. You need to talk to the community leaders, You need to talk to those living in the public housing developments. You need to make sure that you know the demographics of those developments, and based on that, then you can discuss internally with your clinical and non-clinical staff the need to provide this training, and at the same time how you can incorporate CHWs in the prevention program. It's the same for the cervical cancer prevention. We discussed the use of the HPV vaccine as part of this learning collaborative. And if there is the need to increase the immunization rate, this is an excellent opportunity to have CHWs involved. And we had a learning collaborative a few months ago on the AMIGAS program. This is a CDC evidence-based program that is specifically for CHWs. If you didn't have the opportunity to participate, you can go to our website again and look at the AMIGAS sessions. Or you can also go to the CDC Centers for Disease Control and Prevention website, look for the AMIGAS program, and you will find information on how to put in practice this evidence-based program and include CHWs. The other approach is to talk about or to use the schools. As we heard from Altamed, this is one of the approaches that they've been using in Los Angeles County, California. Then remember that there may be some programs in place in your community, so you don't have to go back and build something from scratch. You know, you need to talk to the school, you need to talk to the leaders again in the community and see whether there is the opportunity to include your CHW in the sexual education programs that they may have in place, or the abstinence-based programs or the abstinence programs that they have in place. The other option is to develop your own program and use the clinic, you know, at the site as the site for providing this training. Then FIDE in the second session provided some information about how to make this session interactive, how you can discuss these issues with teens, and she provided at least 2 or 3 examples on how to make these meetings with teen interactive. So you make sure that they receive the information that they need, and at the same time that they don't get bored. You know, when you discuss some issues, some health issues that sometimes are difficult to discuss with teens, you need to make sure that the sessions are interactive so you can get the most out of the conversation with the teens in your community. And the other 2 approaches are, one, you need to work with the community. I mean, remember that this is something that you can do at the community level. You can go to the public housing development, discuss this with the public housing leaders. They may have some rooms available where you can provide the prevention program. And there is the opportunity to talk, you know, HUD has a new initiative. This is the Envision Centers, where they have places, where they have physical places where you can go and provide not only sexual education, but any kind of health promotion. If you have a health promotion program, you can discuss this with your public housing agency. And finally, you can use media to deliver the message. You can use your social media, Facebook, Twitter. You can have public announcements. You can discuss this on the radio if there is the opportunity, and bring teens together, you know, so they can discuss the pregnancy prevention and the different ways to prevent pregnancy, and the different ways to prevent STIs or HIV. I mean, all these topics are intertwined and they are linked. So this is a very good opportunity to discuss all these issues, and very importantly, discuss any mental health, issue. And if there is one, or then to provide to refer the teens to the appropriate services in your community, or the behavioral health program that is part of your community health center. Next slide. In regards to family-based approaches, we have some advantages, but we have also some disadvantages. I mean, these are the best, I guess, way to, I mean, if you are not working with the teens, you can include family members, specifically parents, in the prevention program and the education, the sexual education. And remember that the parents somehow are the primary socializing agents. So teens, they know their children, they know what the issues are, they know what they are facing. This is a very difficult part of everybody's life, when you are not a child anymore and you are becoming an adult. So there are a lot of issues that you can have during that process, and parents are the most important ones, to address these issues. And there has to be a very good communication with the children and with the kids, and so this is the best way. One of the topics that they will be interested in working with you if you address the need with the parents. Remember that, I mean, they are the experts. They know what the needs are. There is another issue that I believe is quite important at the health center level, and is the fact that health centers serve communities from different ethnicities, for instance, and from different cultures. And even if you have a very good program, or you are modifying, or if you are adapting one of the evidence-based programs, sometimes we are not familiar or totally familiar with the culture or the beliefs of these families. And this is a very good opportunity to include the CHWs in the conversation. I mean, CHWs who may be who are part of the community can have discussion with the parents, and since they probably share the same culture and the same beliefs, then this is an excellent opportunity to discuss it from the family perspective. Next, in regards to the family base, the other issue that is very important, at least in the Hispanic population, is the religious beliefs. Remember that as Hispanic, I can say that this is a big issue in the community, and you need to be very sensitive. You need to be very, it's a very touchy issue. So it's part of the cultural competence and cultural humility training that CHWs need to have. Next slide. Now, what are some of the disadvantages or some of the criticisms? Based on some research, adolescents or teens in particular are peer-oriented. They tend to have this conversation with people who are, if not the same age, they probably are about the same age. And sometimes they do not have the trust to talk to adults, and specifically parents, about sexual behavior and pregnancy. So this is a issue that you have to have in mind. As Altamed mentioned, they train CHWs, and they try the peer-to-peer matching, so they can provide the teen pregnancy prevention information or to other adolescents, and they try to have adolescents who been part of the prevention program that they have in place. Then sometimes parents, as we saw on some of the videos, they lack the information about how to address these issues with the children or with their children. And the other big issue is that sometimes the families can be dysfunctional. Parents may be experiencing other issues, either there is issues like domestic violence or lack of communication or drug misuse, so those are issues that all can affect the family-based approach. And then is time. Sometimes parents do not have time to address, to go to the training or to go to the program to learn how to deal, how to have this discussion with the teens. Next slide. All right. Remember that all these outreach approaches require innovative strategies. You will find a list of different evidence-based programs that you can modify and you can adapt to your needs, but you need to be innovative. You know your community. CHWs know the community and they know how to work with the community and what it works and what doesn't work in the community. So you need to involve CHW so you have a better understanding of how to address teen pregnancy and HPV prevention in the community. Then the need that programs that will reach parents where they are, that's another issue. Remember that you need to adapt your time to their time and make sure that this is going to work, because if you have a session or you have a program that probably 6 sessions, but you only have the participation in 1 session and then the parents miss the other 5, then probably they are not going to learn anything, and at the same time they won't be able to address the teen, the need to educate or the need to provide the information to the adolescents living with them or their children. And then remember that this is a great opportunity for healthcare workers, because they are linked to the family, they are linked to the community. And if you are planning to address the teen pregnancy issue, the family-based approach and the adolescent approach, the direct adolescent approach, are the best ways to provide these kind of programs in the community. Next slide. And now I'm going to turn it over to Filia again, who is going to discuss the Family Talking Together program.
Thank you so much, Dr. Leon. So here, basically, we're just going to go over a few examples of some programs that are family-based and youth-based programs. So first, this Families Talking Together program. The goal here was to increase parenting behaviors designed to impact adolescent sexual decision-making. And the program was basically implemented in face-to-face sessions with interventionists with the use of family workbooks. So the family workbooks were basically a collection of different materials that were also cultural competent. The target population for this program was the African American and Latino parents of youth ages 10 to 14 years old. And this program has been categorized as an effective program by the U.S. Department of Health and Human Services. So some of the key features of this intervention is that at the adolescent level, they address determinants of adolescent health behavior. At the parent level, they address parent factors associated with adolescent sexual behavior. And more specifically, they address topics that had to do with communication, monitoring and supervision, and relationship satisfaction. So mostly the relationship satisfaction had to do with between the parent and the teenager. Mechanisms that link parent and adolescents together. This was another topic that they also took into consideration. So what was the impact of this program? So the program effectiveness was first evaluated from a randomized control trial that involved African American and Latino youth. Adolescents and their mothers were recruited at a community-based health clinic in the Bronx borough of New York City. And the key findings from this first evaluation was that 9 months after the program, the youth receiving the intervention were statistically significantly less likely to report ever having engaged in vaginal intercourse in the past 30 days. But no impact was reported on the rates of oral sex. So next we're gonna take a look at a video that basically just gives us an overview in more detailed information about who were the participants of this program. And I hope you guys enjoy the information.
It was kind of awkward because I don't feel comfortable talking to my mom about
Which it is sort of awkward to be able to sit down and talk with your child.
Es difícil, because a mí no me gusta mucho. I don't like it, but hablar sobre mi vida personal con ellas, then that's my example cuando yo hablo con ellas.
Families Talking Together is a program that's designed for parents to help you address an issue that oftentimes can be very challenging, teen sexual behavior. We lay it out in a way that's straightforward, and we can help you to make what you do as a parent effective and help you achieve what you want, which is to have your teen do well, stay in school, and avoid an unplanned pregnancy, STI, or HIV. So here are two suggestions that may be helpful to parents as you think about trying to talk about these issues with your adolescent child. The first is look for opportunities that occur in your day-to-day life. And so there may be, for example, a TV show, there may be a teen in the community or at school, or something that's going on in the world, in the media, that will allow you to check in with your teen and ask, well, what do you think about that?
Like if we was watching TV, if something would happen, she would like, see, this is like just acting. But like this was just, these are all grown-ups and everything. They know what they're doing and stuff, and then she would start talking.
Another approach is simply being direct. As a general rule, it's going to be really important for parents to convey, if they don't think that this is a time in the adolescent's life to have sex, that they make that very clear to the teen.
Yeah, usually parents have some weird, like, nasty attitude talking about sex, and they don't know how to talk to teens about it. They don't know how to control their attitude, and it's a problem sometimes.
If your child is saying something to you that you disapprove of, and your first reaction is, oh, that's really wrong, you shouldn't do that, and how could you do that? How could you even think about that? And if that happens continually, your child's going to shut down, and they're not going to share things with you.
My mom, she would be the type that would yell at me and say, Lonnie, what are you doing? And that would make me feel, pressured and make me feel like, all right, this is not how you should be talking to me. I'm going to do it anyways now because of the way you're approaching me about it.
Well, if you're going to sit down and talk with your children, and like I read in the handbook, you definitely should approach it in a calm manner. You don't want to get yourself upset because then your child becomes upset. And once the child becomes upset, then they're going to regress and not want to say anything to you.
Sit me down and have a nice, soothing voice. Like, don't yell at me.
One of the biggest sort of issues that many teens report is that they know that their parents don't want them to have sex at this time, but they're not exactly sure how they can say no to sex. They want their parents to help them with specific strategies in terms of how they can resist peer pressure. What do they say?
Like, you know, they'd be like, come on, it's okay. Like, it's nothing's gonna happen. And girls, they believe that stuff and they feel like, oh, okay, he said it's gonna be okay, so it's gonna be fine.
You know, one of those things might be, for example, simply saying to the boyfriend or girlfriend or to their friends, if my mom knew that I had sex, she would be really angry at me. I can't do it. The program that we've developed has an entire section that really helps parents to offer their teens very practical strategies. And it's specifically designed to take this issue of how to talk to your teen about sex and make it something that all parents can do.
All right. So that was a really good overview about what the Families Talking Together program really is about. So next we have basically another program which is called Familias Unidas or Families United. And this is a family-focused intervention that is geared to prevent and reduce substance abuse and unsafe sexual behaviors among Latino adolescents by improving family functioning. The target population for this program was Latino youth and their families as well. So this program can be implemented in any setting and delivered in community-based organizations and in school settings. It was previously evaluated in a community-based setting in Miami, Florida. So what has been the impact of Familias Unidas? So the impact, as we see here, it had a wide range of different impacts. In regards to drug use, there was found that there was a 28% less usage of drugs. There was 38% less depressive symptoms reported by youth. There also was a 50% less alcohol dependence, 60% less unprotected sex, and 88% of cigarette use reported by Latinos. So next we have this other program which is called Cuídate, and in English that translates to take care of yourself. So this was basically an adaptation of another program, which is called Be Proud and Be Responsible. And this is a culturally tailored program that takes into consideration the cultural beliefs to frame abstinence and condom use. So this is a really good program that basically, that is delivering information in Spanish as well. So it focuses on increasing participant skills and self-efficacy on communicating and negotiating with sexual partners about abstinence and condom use. The target population here is Latino youth between the ages of 13 to 18 years old. And it was designed for and evaluated in school and community-based settings. So next we have an overview of the impact of this program. So this program was conducted as a randomized controlled trial. Latino adolescents were recruited from 3 neighborhood high schools and community-based organizations in Philadelphia, and surveys were administered before and right after the program. So the major findings here was that the youth intervention group were significantly less likely to report having had sexual intercourse and having had multiple sexual partners in the past 3 months right after the program was implemented. They also reported significantly fewer rates of unprotected sex among Latino adolescents. Next, we have the Sisters Saving Sisters program. So this program basically addresses the high risk of HIV STDs for female adolescent populations. Earlier throughout this Learning Collaborative series, we also spoke about preventing HPV. So this is something that this program also addresses in regards to STDs. So designed to reduce the frequency of unprotected sexual intercourse with and without alcohol use, number of partners, and incidence of STIs. It was created for and evaluated in community-based clinic settings. And the target population here was also Latina and African American female adolescents. So what was the impact of this program? It was also conducted as a randomized controlled trial, and youth were recruited from a family planning clinic in Philadelphia, Pennsylvania. They were basically divided in 3 different groups. So one group basically received the Sisters Saving Sisters intervention. Another group received treatment. Another group was considered to be the treatment group, where they received informational sessions on HIV and STD risk reduction. And then the third group was basically receiving general health promotion education. And this general health promotion education was mostly focused on providing education on cancer prevention, on heart disease, and other chronic conditions, under health conditions. So some of the findings here were that after 12 months after the intervention, the youth that participated in the intervention group reported significantly fewer sexual partners in the previous 3 months. And they were also less likely to test positive for gonorrhea, chlamydia, or trichomonas. So this is just another additional resource that you can also access online. This is through the youth.gov website. And in the search engine, you can type HHS Teen Pregnancy Prevention Evidence Review on youth.gov. So basically you can, if you go to the Find a Program tab, you can basically find a whole list of different evidence-based programs that address adolescent health. And they provide an overview of each of the programs and also even the contact information of the people who were involved in each of these programs. So I hope this is some really useful information that you guys can apply in your health center. And I'm going to pass it to Dr. Leon.
Thank you, Fide. And before we move to our next learning objective, remember that after watching the video on the information about the 3 programs that Fide mentioned, that first is difficult to say that there is a evidence program that fits, then or that has the information for all communities. That's the reason why we said during our first session that you need to assess the needs. You need to know the demographics, and then you need to know whether you are going to work with the parents or you want to work with the adolescents. Then after watching the video, you mentioned it's important to highlight the need that even though this is a teen pregnancy prevention, remember that there is also the opportunity to include boys, not only girls. So as you said, when you mentioned the 2 or 3 programs, there is the need to also make sure that you are including boys, because I mean, they need also to be educated, and because they need to be responsible, and these are basically the takeaway messages that we discussed from the very beginning. And as we said, we are not going to promote one, because there is no one-fits-all kind of evidence-based program. The youth.gov site has a list of many evidence-based programs that you can adapt. And if you, every time that you look at one, you can find the contact information of the researcher who is responsible for the program, and you can reach out to them and discuss your need, and then you can adapt the program based on your needs. So next slide. Let's talk about the inclusion of community health workers in any of the programs, either the teen pregnancy program or the HPV prevention program. Remember that CHWs have been included in many programs in the past. This is nothing new. The CHWs with the training, with the basic training and with the appropriate training, are able to address the needs in the community. And then, as we see, as we discuss this topic, they can be used in different sections or different areas when you are planning your prevention program. But remember that CHWs are used or have been used to increase the rates of mammograms, and breast cancer and cervical cancer have been two of the areas where CHW have been included. HRSA has the diabetes initiative now, and the CHWs are being included in the promotion, either through the prevention through physical activity or nutrition. And CHWs in other countries have been used for tuberculosis prevention. And so if you see the smoking cessation, that is another hot initiative, the banning of smoking in public housing. So these are just examples that the CHWs with the appropriate training can be used, and they can provide or be part of the team addressing the teen pregnancy prevention or the HPV vaccine prevention. Next slide. Remember that CHWs have different advantages, and first, they know the population, they are part of the community, they are the part of the team or the member of the team who goes to the community, and sometimes it is hard to reach populations. It's not easy to work with either public housing residents. Sometimes you need to have the trust of the community. Public housing developments have the leaders in the community, so they need to know the leaders. So in order to address any issue, any preventive program that you need to have in place in public housing, you need to make sure that you talk to the public housing leaders. They are basically the key to enter to this population, and provide any kind of training that you would like to provide in the community. Remember again that the CHWs know the community, they know the needs, they have interaction every day with the community, so they are an important part of the community, and they need to be used. They have to be used either through a program that is aimed at educating parents, or the peer-to-peer program that Alta discussed in session number 3. So either way, you can either train new members, specifically young members in the community, to go to the public housing development and discuss this issue with the other adolescents in the community, or you can also use your adult CHWs, and they can have this conversation with the parents. And then remember that this is an excellent way when you include a CHW to eliminate some of the barriers that you face when you have this interaction with the community. So in addition to providing the right education or the appropriate education to the CHWs, remember that they know the community, that they know when and how to reach the community, and most importantly, they know the leaders of the community and they have the access to that population. Next slide. Then remember that some of the health centers, specifically, I am going to talk about the public housing primary care grantees. As we discussed on our first session, our first conference call, we said that the Hispanic population or PHPCs in general serve a large number of Hispanics in the community. The reason that we mentioned was that some of these developments are located in big cities, in large cities, where there is a high concentration of Hispanics. So remember that sometimes, due to some immigration issues that they may have, they do not go, or they try not to get involved in any of these programs because they fear that there may be some legal issues. Remember that probably these are not population that are legal residents in the United States. So this is a way, to get or to gain the trust in the community if you use the CHWs, specifically if you are addressing these needs in the Hispanic population. Now, remember that there is also the flexibility that CHWs increase knowledge regarding certain health outcomes or behaviors. I mean, as we said in the previous slide, CHWs have been used to provide health promotion and educate the community in other areas, very important areas: HIV/AIDS prevention, STI prevention, diabetes, cervical and breast cancer. So this is another opportunity, or this is another topic that they can get involved and provide the training and the education that the community may need to address teen pregnancy. And then remember that in addition to including the CHWs in this program, I mean, there is also the opportunity that if they go to a household to discuss other chronic conditions, at the end, remember that this is an integral education, that even though you are going to discuss probably cervical cancer, or you're going to discuss teen pregnancy, and if you are talking to parents, this is another good opportunity to discuss with parents their chronic medical conditions and whether or not they are receiving services in any of the clinics that you have in the community. Next slide. So there are some challenges as well. We've been discussing about benefits and challenges, and one of the difficulties is the fact that sometimes you need to train the CHW. Again, you will have to provide the basic training. You will have to have the meetings with them. You will have to talk to the CMO or the program director. These are going to provide some kind of basic training. You need to find the resources. So there is some involvement of, for instance, funding that you need to find to address these issues. That's the reason why it's very important to assess the need in the community, and then based on that, you can provide the training to the CHWs. Now, some research or some studies have determined that it is difficult to say whether or not CHWs play a very important role, you know, but there are others saying otherwise, you know. So there is that mix, and then when you are trying to address an evidence-based program, make sure that the evidence-based program that you are planning to adapt in your community is an evidence-based program that includes CHWs. So at least have the education component where CHWs can be included. Then the other topic, the other challenge is that training and evaluation processes for CHWs, right? There is no established uniform training. Remember that there is no like a degree for CHWs. You know, you have to adapt, you have to talk to, you have to train the CHWs in any of the issues that you would like to address in the community. I mean, internationally, as we mentioned, that they have been used to address very difficult topics like tuberculosis. TB is a disease that you need to train people a lot, so they know what the issues are, not only regarding the mycobacterium, but regarding all the social aspects that include the transmission of the mycobacterium in the community. So, I mean, with the appropriate training, CHWs are an important part of your team. And then remember that sometimes some of your CHWs may not be full-time, so you need to make sure that you have you need to adapt to schedules and other issues and you need to make sure that you address all that issues when you put your program in place. Next slide. Well, remember that CHWs can have different roles. I mean, they can provide education, but they can also help with case management and outreach. So these are the three important areas where you can include CHWs in your program: education, case management, and outreach. Next slide. Now, in regards to the interventions, remember that you need to prioritize. You need to make sure that how you are planning to use them, how you are going to get the most out of the ability that CHWs have in the community. So make sure that you develop a program where the CHWs play an important role in the community and with the members of the community. If by doing so, you are going to have the involvement of the CHWs in the sexual and reproductive health intervention that you are planning to have in place. Next slide. And the importance is to prioritize, to make sure that you have CHWs working with the target population that you have in place. Again, based on the interventions that we had from the health centers who participated on the previous calls, you can either use adult CHWs to work with parents, or teenagers who are part of probably some of your teenage programs or teen education programs, to serve as a peer-to-peer educator and bring the teenagers to your health center and receive not only this sexual or reproductive health intervention, but other services that may need. We've been highlighting and underlining the need to provide behavioral health intervention as well. remember that some of these pregnancies and some of these issues are based on there is a violence aspect included. So as Peter mentioned, that is one of the issues in the public housing communities. So we need to make sure that in addition to provide all health education, all the health education that these teens may need, then we need to make sure that we include the behavioral health component. Next slide. And we have finalized the LC series. Before we get into the Q&A, remember to please complete the post survey. Help us with the information that we need to improve our learning collaboratives. And if you have any questions, please either use the comments or the chat box, and you can type your question, or you can use the raise hand icon and your line will be unmuted. Again, remember, we have a COVID-19 conference call tomorrow with public housing primary care health centers. If you are interested in participating on this call, make sure that you contact any of the NCHPH staff members. You can contact me directly, jose.leon@namgt.com, and we will send you the link. Again, thank you so much for everything you're doing to address the pandemic. If you have any challenge, if you would like to share any best practice, we are more than happy to hear from you. So, Fide, do we have any questions?
Yes, we do.
Okay.
Steve, while I pull it up.
Sorry, Fide?
So we have one question.
Okay.
This attendee basically says, how long do CHWs usually stay in those positions? Is it necessary to recruit on an ongoing basis? And what is their recruiting strategy?
You know, it will depend on the evidence-based program that you are planning to adapt. You can use your CHWs if you are going to work with parents. You have to train them. You have to provide the basic training, the resources that they need. You can download resources from the Centers for Disease Control and Prevention site, and use all the infographics and fact sheets that they have in place. And remember that the CHWs are not the only one providing the education. I mean, this is a team-based activity. So the CHWs will provide some of the basic training and share some of the experiences with the target population, but they are not the only one. So you need to make sure that you have a plan for each of the sessions that you are planning to have, and who is going to be responsible for each of the sessions. Now, if you are trying to use the peer-to-peer, probably you will have to recruit some CHWs. One of the best practices that we got from Altamed on session 3 was that if you have another teen program in place, you can use those teens, train those teens, who are part of the community, so they serve like the ambassadors of the health center in the community and bring new members of the community to the clinic. So that probably will require some recruitment, but it will depend again on the evidence-based program that you have, or the evidence-based program that you are planning to put in place.
Thank you so much, Dr. Leon. We have another question that says, if boys are included, how do you need to modify the program and training?
Sorry, can you repeat the question again?
Yes. If boys are included, how do you need to modify the program and training?
That's a good question. And basically, remember that the youth.gov site has different evidence-based programs. and they are not only for girls, that even though the education, you know, and the is aimed at preventing pregnancies, that doesn't mean that you only have to include girls. Any evidence-based program that you would find on youth.gov basically addresses the need of including both boys and girls. And remember that even when you are going to use the basic sexual education ABC intervention or ABC program, the abstinence message is for both, for boys and for girls. The B for be faithful is for both, and the use of condoms is for both. So any of the, you don't have to modify the program, you don't have to adapt or go or revisit the program, because all the evidence-based programs that youth.gov has and the CDC has in place, and they've been funding for many years, include both boys and girls. Any other questions?
We have one more.
Okay.
And basically, this is in regards to the certification of CHWs. Is it necessary to get CHW certified by the state or certifying organization?
You know, that's another good question, and it's part of the challenges that we mentioned. And each state is different. Each state has different policies. So my recommendation is to make sure that you discuss it with either your local Department of Health or your state health department, just to make sure what the requirements are. To answer the question and give a general answer is that there is no requirement. I mean, because there is no CHW degree. You know, this is something that you have to adapt, you have to train, and they will do the outreach in the community. But just you need to make sure that you abide by the policies in your state. So my recommendation is to go and discuss it with the state health department or the local department of health.
That is it, Dr. Leon.
Well, thank you so. Next slide. Thank you so much. I believe that we went a little bit over time. Please visit our website and join our mailing list. You will find information on HRSA updates, funding opportunities, and other resources, upcoming activities or past activities. You will find archive webinars, archive learning collaboratives. Remember that you are going to receive the slides and the recording for this learning collaborative via email, but also you can visit our website where you can find all this information in addition to interactive maps and other publication from the National Center for Health and Public Housing. And these are our contact information, so make sure that if you have any additional questions, do not hesitate to contact any of the staff members. And if you would like to join the COVID-19 call tomorrow, that's my email address, the email address of our director, and all the members of the NCHPH group. So thank you so much. Have a good afternoon, and thank you for being with us. Thank you.